Hi Shift community, welcome back. I'm Sammy, cancer exercise and lifestyle medicine expert. So today I want to cover what are the 6 pillars of lifestyle medicine. So stay tuned and we'll cover them in detail, and not only that, how you can activate those in your life. Okay, as we get started into the 6 pillars of lifestyle, I want to remind you that yes, there are 6 pillars. These are exercise, nutrition, sleep, stress, social connections, and unhealthy habits. In relationship to cancer, only 2 of our pillars actually have the science behind those. So those are the ones that we're going to start talking about first. The first pillar, the one that everybody asks about, is nutrition. What is lifestyle medicine in nutrition? So we know that a plant predominant diet is the most important one that you can strive for as a cancer survivor. So what does this mean? You want to have plenty of fruits, vegetables, whole grains, seeds, and nuts on your plate in your diet every day. Does that mean you can't have animal products? Absolutely not. And in fact, we know that many of the animal products are completely safe as a cancer survivor or someone who's wanting to prevent cancer. These include things like poultry or dairy or other things that you may really enjoy. What we want to think about though is that plant predominant should be at least 60, but all the way up to 70 or 80% depending on the diversity of your diet. Now, if you're wanting to think about things like red meat, that's a very different discussion, and we have a video specifically on red meat and cancer that you can check out. Okay, the second pillar of lifestyle medicine is exercise. Again, this is another evidence-based pillar. We want to think about the role of exercise, both aerobic and strength training, as part of your regular weekly routine. The recommendations are pretty general. It's around 150 minutes of moderate exercise per week, including at least 2 days of resistance training. However, you can piece that together in any modality that you would like. The most important thing that I want all cancer survivors to really understand is that we want to have that combination of exercise, and often by prioritizing resistance or strength training, we are building back skeletal muscle tissue, which we lose after a cancer diagnosis at 10 times the normal rate. And it's one of those muscle tissues that helps us reduce the risk of a lot of other diseases. So I want you to think about having a regular exercise regimen of aerobic and strength every single week. All right, the next pillar that I want to talk about is sleep. So what do we know about sleep in the cancer space? Well, we don't have a lot of great studies that look at how sleep quality and quantity actually influences cancer cells. But what we do know is that sleep disruption is very common in individuals after cancer or going through cancer. And this is for a number of reasons, from medications to emotional stress to just having the side effects that happen after a diagnosis. But what I want you to focus on is, although sleep isn't an evidence-based pillar, where all of our cells actually repair is while we sleep and rest. So prioritizing a healthy sleep routine that actually gets you into that routine to fall asleep, stay asleep, and wake up is one of the most critical things that you can do as a cancer survivor. All right, the next pillar, pillar number 4, is stress management. Again, this is one of those that is really hard to kind of understand from a scientific standpoint. But what we do know is that when we are living in acute, short-term, or chronic, long-term stress, there's a lot of things that happen in our body from a general inflammation standpoint, and also just feeling like we have a hard time coping with life. We maybe don't have the healthiest habits. We're not as excited to exercise when we're feeling stressed. We may not have the same dietary habits, whatever they may be. However, we know that managing your stress doesn't necessarily correlate to very specific cancer outcomes, but is an overall important part of healthy well-being. So I want you to think about having a regular stress management strategy, including some of the ideas on breath work, which again, we have a lot of other videos for you to check out so you know how to activate those immediately. Okay, pillar number 5 is all about social connections. And I know this actually seems really easy. However, we know that social connections in our current technology world, we have lots of social connections, but maybe not as many true connections. The amount of loneliness and isolation in the United States and cancer survivors is equivalent to the risk of smoking 1 pack of cigarettes per day. So I want you to think about, although we don't have evidence on risk reduction, having strong social connections improves quality of life and potentially length of life. So make sure that you're looking for good connections, striving to build community, and also having a good connection with yourself as you go into the next months and years after a cancer diagnosis. All right, the last pillar of lifestyle medicine is actually one that I think is often the easiest to start with, which is avoidance of unhealthy habits. So what does this mean? Well, traditionally in lifestyle medicine, we think about tobacco and alcohol. I can't go past alcohol too quickly without reminding you that any amount of alcohol for a cancer survivor is considered to be risky. So take that in mind when you're looking at your habits. However, two unhealthy habits that are not talked about enough is number one, inactivity. So yes, we talked about exercise earlier in this video, having a planned exercise routine. However, if you exercise 30 minutes a day, but then sit or rest for the other 23 and a half, you actually negate your efforts to exercise. So I want you to think about moving a little bit, whether you're in the chair or you're getting up and moving around your house every single day when possible. The last one is sugar-sweetened beverages. So we have a lot of science in this looking at some specific types of cancer, but I want to think about this as a general population. The average adult in the United States is consuming 3 to 4 times the sugar consumption recommended by the American Heart Association, which is 25 to 35 grams. Where we have science is looking at sugar-sweetened beverages. So yes, those sodas, but also things like sweet teas or even that coffee drink that you get at that bougie coffee shop down the corner. So make sure that you're paying attention to what is in your beverages and trying to stick to plain beverages whenever possible. All right, now that you know about all 6 tips of lifestyle medicine, I hope that you will continue to incorporate those into your regular life. Don't forget to subscribe, stay tuned, and we'll be bringing you more content in the future.